So diversion, let me look at that first. And how do they do this? There's kind of 3 steps to it. And the first step is pot doctors. Patients don't go to their primary care doctor. When the law got passed in Arizona, I got all these calls from my patients for about 2 months, and then nobody called me again, because a handful of doctors set up practices where they do marijuana evaluations, and they give everybody a yes. And there's a study that was done in California that looked at 1,600 patients who applied for a marijuana card. Only 2% were turned down, and they were turned down because they wouldn't even pretend to have an illness. Here's an ad from a California medical marijuana consultant. If you don't qualify, your consultation is free. So you can see there's obviously motivation to approve everybody. I knew one person who said that the secretary actually typed up the marijuana card before he even saw the doctor. And what happens in states is a handful of doctors write almost all the recommendations. So in Montana at one point, 10 doctors had written 90% of the recommendation. One doctor had written 40%. He did a thriving business. In Arizona, 24 doctors at one point had written 3/4 of all the certifications, and naturopaths wrote 2/3. Arizona has a big naturopathic medical school, but it's not covered by insurance, and they really don't make good money, and they spend a lot. So I've talked to some of them, and they know it's a scam, but they need the money. And that's who really does it. Doctors who can't earn money any other way. And so pot docs basically give a recommendation to anyone who pays their fee. It's, you go to a regular doctor and say, I want Xanax. They'll do an evaluation and decide if you really need it. It's different. So step 2 of diversion is the pain loophole. Most of the patients claim pain. The most common things people get medical marijuana for are pain, anxiety and depression that it does not work for, and insomnia, which I wish they wouldn't use it for, but it works very well. So there's a study done in 2014, looked at 7 states, got their data. 91% of the patients got the pot for pain, only 3% for cancer, 2% for all the other serious illnesses. A study published in Cannabis and Cannabinoid Research, is a very pro-marijuana journal, found that 61% had pain, 58% anxiety, 50% depression, only 3% cancer though. So remember, they advertise these medical marijuana laws. You don't remember. I remember in Arizona that all their ads were about cancer. No, it's not really for cancer. So in Arizona, 93% pain, 2% of the patients get the pot for cancer. In Colorado, again, 93% get the marijuana for pain, 5% for cancer. Now in Rhode Island, it was only 61% pain and 6% cancer. But it's still primarily pain. So the problem with pain is it's easy to fake, it's hard to disprove, there's no objective test. In Iowa's law, Iowa has a CBD law, but it allows untreatable pain, and 52% of the CBD patients do claim pain. So it's still similar. The question is, are they genuine pain patients or are they substance abusers? So step 3 is who are the patients. And the journal Harm Reduction, which is a very pro-drug journal, published this study about 4,000 medical marijuana applicants, and it found that the average patient was a 32-year-old male, and 88% of them had been using marijuana since age 19. In Montana, at one point, 10% of everybody on probation and parole had a medical marijuana card. So there is evidence that medical marijuana patients are almost entirely substance abusers, but it's not perfectly clear. I work in a community mental health center. I do substance abuse work and I do general mental health. None of my general mental health patients have a marijuana card. My substance abuse patients, huge numbers do. So 90% claim pain. They often believe it themselves. I mean, these patients, I don't think some of them are just lying, but I think most of them really believe that it works for their pain. So the question is, okay, but what is really unconsciously, what's really getting them to do it? Is it the pain or the substance abuse? Which disease is talking? And so I've submitted this study and I never heard back from the journal. I haven't heard back yet. So pain patients are mostly female. I found one study that 55% female, whereas substance abusers are 2/3 male and 1/3 female, and that includes marijuana abusers. I had a patient who did this. She was looking for a pain doctor, and she walked into the waiting room, and it was all young guys. And she said, "This isn't a pain doctor. This is somebody who's misusing his license to make money by handing out opiates. I don't want to see him." And she turned around and left. She found another pain doctor. She walked in, and it was mostly older women. She says, "This is a real pain doctor's office." So we know that. Same is true with medical marijuana programs. So I contacted all the medical marijuana programs at one point, and I asked them, what percent of your pain patients are male? And I got results from 7 of them. And so on this graph, you can see it pretty well. So the green is less than 50% male, and that's where you would see if everybody were genuine pain patients. It would be mostly female. And then the blue is the area around 2/3 male, and that's what we would see if everybody were substance abusers. And they were really, they thought it was pain, but they were really motivated by their substance abuse. As you can see, all 7 states that contacted me are pretty much in the substance abuse range. The lowest is Oregon at 61%, but it's still close to that. So what this says is these patients are saying they're getting the marijuana for pain, but their demographics say substance abuse, not pain. If the demographics for pain would be less than 50% male. So I'm highly suspicious. And they think they're using it for pain. I think they're pretty convinced. So what I found with my own patients with marijuana cards is there's a tiny number with no history of substance abuse. Seriously, a few per year. All the rest have a past history of substance abuse. And for the ones with psychiatric complaints, the problems get better when they stop using marijuana. So there's 3 types. There's the ones who are just plain lying. And I saw a lot of people like this when I worked in a substance abuse program, and they'd come in and say, oh yeah, I had a marijuana card. A friend of mine told me what doctor to see and what to say, and I did it. Nowadays, mostly I see people who are substance abusers who really believe that they are treating pain, anxiety, and insomnia. And I'm suspecting that a lot of this is denial. And then every now and then I see a genuine medical patient. So why do I suspect this? What's going on here? And the reason is because we've seen it with alcohol and cigarettes. I saw all these alcoholics when I was younger, and they would always say, oh, I drink because I'm depressed. Well, actually, the depression got better when they quit drinking. Cigarette smokers often say, oh, it helps me relax. But the research shows that smokers are more relaxed when they completely get off cigarettes. And the marijuana users, weed calms me down. And it's really not anxiety. They're really talking about anger and irritability. And it actually gets better when they quit using marijuana. So why do they think that it helps? And there's a lot of reasons. One is they could be medicating withdrawal symptoms. Irritability is a symptom of marijuana withdrawal. They could be medicating feelings, which is exactly what drug addicts do. I heard one person who said, her quote that she liked to use at AA meetings is, I thought feelings were the disease and alcohol was the cure. And then also a brief burst of a good mood or relaxation or calm. And I remember this. So I like to say that I quit smoking pot at age 19, but actually I kept trying it every few months for several years. And each time I would try it, it was great for 10 minutes and then it would be awful again. I'd remember why I quit. And people do that with that drink. It's like for 10 minutes, it's really good. With the cigarette, they feel really good for a minute or two. And then also the addictive pathways. People with an addiction, their mind is always telling them that this is the answer and they believe it. And then there's euphoric recall. I've never found this study, but I remember hearing about it. And so I'm going to quote it because I think it does work. Where they looked at alcoholics and they gave them a depression test when they were drunk and they said they were terribly depressed. And then they gave it to them when they were sober and they said they were feeling okay. And they said, okay, now rate how you felt when they were drunk. And they said, oh, I felt wonderful. And they call that euphoric recall. And I think that's part of what goes into this. And also addicts will make up symptoms. I had a patient who was 6 months sober. This was back in the 80s. She found a bottle of Tuinol, which is an old barbiturate, in her house that she didn't know she'd hidden away. And she set it on the dresser and went to bed, and she could not sleep that night. And her mind kept saying, take a Tuinol, you'll fall asleep. And so she got up and got the bottle of Tuinol and poured it into the toilet and flushed it. And she said as soon as it went down the toilet, her mind calmed down and she could go right to sleep. Addicts' minds will make up symptoms. There's just no other way to put it. And I think this is why medical marijuana patients are largely substance abusers and why they often get better when they quit using. And you got to be suspicious when an addictive drug only seems to work or primarily seems to work with people who have a history of substance abuse and they demand it. Something's probably going on besides just plain old medical use. So I'm suspicious of even the patients who tell me, oh, it definitely works for pain. It's like, why is it that only my substance abusing patients tell me that? The other thing is, a lot of them admit that they use it recreationally. They say they use it both. And I found 3 studies on this. One, 55% of medical marijuana users acknowledge that they use it recreationally. And 2 studies, it was 75%. And no other prescription drug is abused like this. I mean, Xanax is highly abused. I think most of the patients do, but probably not 3/4. It might be. And this is the Arizona Medical Marijuana Program posted this graph, and it shows when marijuana sales occur, and they peak on Friday. And then the next highest day is Saturday, and then Sunday, and then it goes way, way, way down. They sell twice as much pot on Fridays as on Mondays. So, how medical marijuana laws cause diversion. Substance abusers who make up or exaggerate a story about pain, or have convinced themselves that their pain responds best to marijuana. And a pot doctor who only makes money if he says yes. And it's really a pretend physician-patient relationship. And my patients admit this, they acknowledge it. But it effectively legalizes the drug for any adult who wants it. And that's what's going on in most medical marijuana states, especially with all these laws. So my belief is that what we should be doing instead, the marijuana helps, cannabinoids help. We should be doing it with the FDA-approved medicines, the Marinol, the Cesamet, the PD-Lex. The research has been done on those, and they do everything that marijuana does, and there's much less diversion because they're prescribed by doctors in legitimate practice. The high is less desirable, and there's no industry targeting teenagers. We hope. I mean, I don't trust the drug industry any more than I trust the tobacco industry. So I want to mention Iowa CBD law, which really, unfortunately, is kind of a medical marijuana law because the Iowa law allows up to 3% THC in the cannabidiol. And this is a graph, you can't see the years, but back in 1970, when I was a teenager, the marijuana was a 1 or 2% THC. So in Iowa, CBD can be 3% THC. You can get high off that. It's kind of like Iowa used to have 3-2 beer. Do you still have it? They get rid of that. You still have it? Okay. Anyway, you can still get drunk on 3-2 beer. Back in the 1970s, it was very low potency weed. But the Iowa CBD law is more tightly controlled. It can only be 3%, whereas people who use marijuana love the stuff that's really high potency, 15, 20% higher than that. Also in Iowa, it's only available, I believe, in capsules, tinctures, and creams, which is not good for getting a quick high. And the other thing is, since the smokable plant is not available, drug dealers can't use it as an excuse. In medical marijuana states, drug dealers all get marijuana cards, and if they're caught with pot, they say, oh, it's my medical pot. And it's really hard to prove that's not true. In Iowa, no such problem. The problem is there's a bunch of states that have CBD laws. Almost all of them insist that it's got to be less than 1% THC. Iowa is one of the highest at 3%, Georgia even higher at 5%. Iowa really should decrease its THC content. The industry wants them to increase it, of course. Anyway, so side effects of medical marijuana law. So I went over diversion. That's a big problem. The second side effect is increased use by adults and teenagers. Like I said, if there's increased use, then all the other problems increase as well.